Before now, there weren't many successful treatments for incontinence, but now board-certified plastic surgeon Dr. Camile Cash is the first doctor to use radiofrequency to treat this condition in our area. Good morning to you.
Good morning.
So what is this and how is it working? Because we've heard that it's on your lunch break, that there's no surgery, there's no pain. I mean, it sounds too good to be true, right?
This is ThermiVa. This is a radiofrequency device. It's non-surgical, so it is performed in the comfort and privacy of the office. It takes about 30 minutes, and there's no downtime for patients. They can go back to their regular activities immediately after the treatment.
Well, and as a plastic surgeon, your job is to try to enhance people's lives, and that's what you were doing. You were using this for different reasons, but found out along the way that it was helping incontinence.
Definitely. So the radiofrequency devices have been used for non-surgical treatments, for skin tightening, for treatment of the neck, and so we did start using this for vaginal rejuvenation, and in turn found that we have improved mild to moderate urinary incontinence by strengthening the pelvic floor and strengthening the vaginal wall.
And so can you give us a little bit of an idea of how it works and what happens during the
So the device is very smart. It delivers a radio frequency through this probe, and it's connected to the monitor, and we are continuously monitoring the amount of energy and heat that were delivered to the tissue to make sure that it's comfortable and safe but effective, because we want to get the tissues to a target temperature and maintain that temperature to create the collagen tightening and the shrinkage of the tissue.
And how quickly is a woman going to see a difference?
You'll see visibly externally changes within the first treatment.
Wow, so the very first day. How many treatments does it take?
Typically, we recommend a series of 3 treatments, although some patients will have improvement after 1 or 2 treatment and will be fine after that.
And how often do they come back?
They come back once a month.
Okay. And then are those results forever, or is this something that they'll need to redo like once a year?
The results should be long-lasting in women who have finished having children. So this is a really great procedure for women who have had children. They maybe have had episiotomies and they've gone through kind of the aging process. The radio frequency, again, was developed for cosmetic purposes. So you're going to have an improvement in the cosmetic area of the external genitalia, the vaginal wall. You'll have improvement to the strength of the vagina, and so that's going to help support the bladder, and women with mild to moderate urinary incontinence are going to notice a big improvement.
Well, and it's an uncomfortable conversation for some people to have, but it's also good to know that a lot of women, especially after menopause, start having trouble with their marriage because they're not comfortable for many reasons. But you're finding that this is helping those women in so many ways. It's changing their lives.
This is wonderful because not only is it improving the cosmetic appearance of the area, but it's really improving dryness that can occur for women after menopause, and the natural lubrication can be restored. The tightness of the area is improved, and patients are having, intimacy has been restored, confidence has been restored, and I have patients that are saying, my marriage is being revitalized, and our sex life is better, and I'm not worried about urinary incontinence. I'm not worried about leakage. I feel comfortable and confident, and so you can erase all those kind of changes you get with childbirth and with aging. So for me as a plastic surgeon doing mommy makeovers with breast and tummy surgery, this is the completion for the mommy makeover.
I got to speak with one of your patients who told me those exact same things, and of course, because it is a subject that could be a little bit uncomfortable, she wanted to make sure I didn't use her name or her face, but let's listen in for a second and see what she had to say.
I noticed immediately when I went to work out the following days, usually sometimes if I'm doing excessive jumping jacks or jumping rope, I might have a little leakage. I had none whatsoever the following day after the procedure. Just knowing that, made me feel, more confident, could work out harder and more. It was just that was a great feeling.
And her list actually went on and on. We didn't end up airing all of that, but her positives were so huge, and she said this was a life changer for me. Let's talk about finance-wise. This was something I would think is still considered cosmetic, so probably not covered by insurance.
It currently is not. It, again, stemmed from the cosmetic arena, so it is currently a cost for patients. We typically offer a treatment package of 3 for $3,500.
Okay, and then again, that replaces a lot of women who are undergoing surgery, and we see all these problems of these lawsuits with mesh and things like that, so they wouldn't have to undergo
the surgical labiaplasties, the needing to buy extra lubrication for patients that maybe have difficulty with intercourse after menopause. This is going to replace that. It's going to really restore women's comfort and
well, Dr. Cash, thank you for coming in, for bringing in the device and showing us something that could make a big difference in somebody's life. Good to see you here today.
Thank you so much.